Morning to one and all. A very blissful morning to one and all present here. I am Mrs. Pallavi Pradhan, working as an assistant professor in School of Pharmacy in Parul University. I feel privileged to extend my greetings to respected Dr. M.N. Patel, Provost of Parul University, Dr. Abhay Dharam Singh, Dean Faculty of Pharmacy, Dr. G.S. Chakraborty sir, Principal of PIPR, Dr. Lalit Lata Jha ma'am, Principal of SOP, that is School of Pharmacy, and Dr. Satnam Singh, Associate Professor in Pharmacology. He is working in Adarsh Institute of Medical Sciences and Research. On behalf of Faculty of Pharmacy, Parul University, I welcome you all the distinguished dignitary to grace the online national webinar on topic rational and judicious use of drugs, clinical significance and therapeutic efficacy. Now, it's my blessed pleasure to introduce Dr. Satnam Singh. He is working as an associate professor in pharmacology department in Adarsh Institute of Medical Sciences Research in Bhatinda. He has completed his PhD in pharmacology, also MSc in pharma, MPhil, diploma in pharmacovigilance. He has also completed certificate course in drug discovery, certificate course in biology of cancer, certificate course in management of diabetes, certificate course in myocardial infarction, and PhD in pharmacology. Currently working in Adarsh Institute of Medical Sciences and Research, Adarsh University, Bhatinda. Then he has a nearby 20 years teaching experience in MBBS, D Pharmacy, BSc Nursing, BSc Paramedical Sciences. He has published nearby 55 publications. Then scientific presentations are 55 and research publications are 26. Then he has attended the various conferences as a dedicated person and speaker, nearby more than the 100. Then affiliations and membership. He is appointed as a member of Punjab State Council of Pharmacy, appointed life member Punjab Academy of Sciences, appointed life member of Pharmacovigilance Society of India. He is elected as a life of Indian Pharmacology Society, member of Institute Pharmacovigilance Committee, member of editorial board of various prestigious and administrative experience. He is a Adarsh 7.5, then member of Academic Council Adarsh University 6.5 years, member of pharmacist and years, member of board of pharmaceutical and hostel MSR more than 6 years, chief editor college magazine, order youth at University. Then he has completed trends and to five school Bali and select participate program at the technology at the participate interaction workshops in MU learner participate of development program sponsorship in job. Participated takes in medicine and practice. Participated as a resource in workshop on research methodology in FHS Farikot, Punjab. So I requested Dr. Satnam Singh to begin the session. Up to you.
Okay, ma'am. Thank you very much for such a nice introduction and very good afternoon to one and all. And am I audible, ma'am? Hello.
Yes, sir.
Yes.
Without interruption, ma'am?
Without interruption. Yes.
Okay, ma'am. Thank you. Thank you very
No
much.
interruptions.
Pardon. Okay. So my today's topic is the use of rational and judicious drugs. Why? Because it is the basically need of the hour, And as well as there are many problems which are being on the rise due to the irrational use of the drugs. And as far as the research is concerned, it has been seen that there are many types of clinical problems which are arising due to the irrational use of drugs. So these type of problems can also be stopped, can also be reversed with the rational use of drugs. And also the one component which is in the domain of therapeutic efficacy, it has also been seen that the therapeutic efficacy will be more with the judicious use of drugs. So basically, I will not discuss in detail all the things, but this is a sensitization type of presentation so that we may be able to understand what is going on and what is our role to stop this type of practice, basically. So let us start with the basic definition. The definition: the rational use of drugs requires that patient receive medications appropriate to their clinical needs in doses that meet their own individual requirement for an adequate period of time and at the lowest cost to them and their community. As far as the definition is concerned, it says the appropriate medicine. Medicine should be correct, it should be matching with the requirement of the patient. The doses or the dosage forms should be correct, and the duration of therapy should be accurate, and it, adequate follow-up should be there. And the in selecting the drugs for the patient, all the parameters like the cost, the economical status of the patient should be taken into consideration. So it is the definition which is given by none other than WHO in 1985. Let us see the simple definition of rational drug. You can be defined as the uses of appropriate drug with proven safety and efficacy for the right patient in the appropriate dose and doses form at proper intervals of time at low cost. Now, the criteria for using medicine. As far as the criteria is concerned, the medicine or the drug should be prescribed only if it is indicated. Appropriate indication should be there. Then, if you are going to prescribe the drug, the appropriate drug should be selected by you. It should be affordable for the patient. The appropriate administration of a dosage form should be there. While taking the doses formed in different doses or during the duration of the therapy. For example, if one can easily use the liquid preparation, should be prescribed liquid one. But if the liquid preparation is not effective as much, you should jump on other type of dosage form as per the factors concerned. Then the appropriate patient. If you have selected a patient suffering from number of types of ailment, you are the key person who is going to prescribe improperly, not a 12 or 20 types of pills or tablets in a time. What are the persistent one? What are the present one? What are the predominating symptoms? So you should go according to that. Then appropriate patient information. That is very important. You should have the history of the patient in a proper way. Then only you are required to go for prescription. Irrational use of drugs. Yes. What is going on nowadays, as far as the internet and the other resources or the research journals are showing that most of the diseases are coming or ailments are coming due to the irrational use of drugs, and there are certain type of hazardous type of conditions which are arising due to the irrational use of drugs. For example, irrational use of antibiotics led to the development of antimicrobial resistance. So it is very important to note here that Not only in case of irrational use of antibiotics, in many other classes of drugs, irrational use led to the serious clinical problems. So this is the need of the hour to stop the irrational use, to educate the students, to educate the community, to educate the clinicians, or to educate the pharmacists. So there are different roles of all the communities working in the healthcare setup. So irrational uses of drugs may be defined into different types of categories. Detonation, it is the irrational use of doses, dosage regime, and duration of drug use. Suppose a patient has been prescribed only medicine for 5 days, and he or she will uh, hesitate to go to the clinician again, and he will purchase the medicine from the pharmacist by just showing the strip of the that medicine. That is wrong, because it is the clinician only who will stop him or who will decide that how much dosage has to be taken. It should be continued, or it should be changed, or it should be stopped. But in the ignorance, they are doing all these things. This may lead to clinical kind of complications. Then self-medication again in India, because in our country everyone is having certain kind of knowledge, and that knowledge into basically most of the time they generally convert that their knowledge into as if they are a good physician, and self-medication is being done by those people. So it is also a basically not good practice. Then easy accessibility of drug, which drug is easily available, that drug will be consumed by the patient very easily. Rampant use of medicines by the prescribers. Prescribers are also responsible to prescribe the things or the drugs or the medicines when they are not required. So, all these reasons for their irrational uses of the drugs. So, there are three types of irrational uses of the drug, or we can say three stages. They are basically irrational prescription at the time of diagnosis, at the time of prescribing the pills, at the time of dispensing. These are the three major, basically, parameters or the factors which are contributing a lot in the irrational type of prescription or irrational use of drugs. First of all, diagnosis. So it how it contribute to the irrational use of drugs when the examination is inadequate and the physician is in hurry and not able to take the history properly. Then the second is incomplete communication between the patient and the doctor. That is very important. Nowadays, the NMC, the National Medical Commission, has overhauled the syllabi of all medical stream, and it has been implemented in the 2019 year. Or there are specific modules which are known as ATCOM module. ATCOM module. First, they have trained the faculty. Now the faculty is basically giving the training to the budding doctors, so that they may be able to communicate the patient properly in a proper way, and they may be able to extract the things from the patient. Nothing should be left. Then only they can prescribe the things properly. Then lack of documented medical history. Yes, this is very important. They will not document the history, and when the patient will come next time for the follow-up or for the next sitting, they will not be able to correlate the things, and they will prescribe as it is. Then inadequate laboratory tests or findings. These are the four sub types of the errors which are occurring at the time of diagnosis and led to the irrational use of the drugs at the time of prescription. Most of the time, if the physician is not able to understand the problem, he or she will underprescribe the pills. Then incorrect prescribing is also led to the irrational use. Then over prescribing or extravagant prescribing or the use of some additional things, irrelevant things, or irrelevant FDCs, fixed dose combinations, all like these, is also a irrational use of drugs. Overprescribing repeatedly without any need. If the viral fever can be cured with the use of simple antihistaminics or anti pyretics or other types of tablets or common cold type of things can be cured, uh, then what is the need of prescribing antibiotics? And it is written everywhere in the literature. It is in the theory, in the practice, everywhere. But most of the time, it is on the part of the prescriber also, and sometime on the part of the patient also. They are not able to withstand. They are not able to wait for 4 5 days. They just start the use of antibiotics in the common cold or other conditions where these type of drugs are not indicated as well. So the overprescription is there. Then the multiple prescription without any reason. If the person is suffering from any kind of skin allergy, then the use of tablet antihistaminics, then topical type of preparation, then topical type of lotion, number of doses forms, where only one type of medication is required, need not to use number of medications. Dispensing, at the level of dispensing, how the irrational type uh, took place. Sometimes, then, due to the ignorance or the innocent, due to the innocent interpretation of the prescription, the dispenser may change the tablet or may give the substitute also. Then a retrieval of wrong ingredients, accidentally mixing of wrong ingredients. Then, and due to inaccurate counting or compounding or pouring of the contents in the uh, container, and the compounding or the preparation or the dispensing in unsanitary environment may lead to the irrational use of drugs. So similarly, in case of packaging, there may be a poor quality in packaging material or odd package size, which may require packaging properly or unappealing package like this. Recreational drug use can be promoted by practicing the concept of essential drugs, providing the adequate training also. There is a essential uh, list of essential medicines which has been given by the uh, CMR and Indian Council of Medical Research also, and has been approved and widely distributed everywhere. So it is very important to have the knowledge about the uh, list of the selected medicines. Reasons for irrational uses of drugs include in India, there are many sources of for providing unbiased information, and many of the prescribers rely heavily on medical representatives who are not properly trained or educated in that particular domain. The drug therapy is effective only when it is diagnosed properly, but in many rural areas, it is not possible. Some of the drugs which are irrationally used by most of the patients or the laymen or the public, for example, aspirin, when it is used for the proper indication or it gives the proper results, but overuse may lead to the fatal conditions also. It is basically it is under the OTC drug list, so anyone can purchase over the counter drug list for acute pain, fever, and inflammatory conditions. So its rational use arises due to its irrational use arises due to its overdose and repeated dose and irrational use, which may precipitate the GI bleeding and ulceration, or sometime overdose may lead to the serious toxic effects, which is known as aspirin toxicity or salicylate poisoning in the medical terminology. Now, the sedatives and hypnotics, for example, diazepam. So these are basically these are prescribed for insomnia and for many other indications. But repeated and overuse of these drugs may lead to the development of withdrawal effects when they are withdrawn. So they are habit producing basically type of drugs. So the improper use or the irrational use may lead to the development of serious types of ailments. Now, the obstacles in the rational use of drugs. What are the obstacles? What are the factors which are being in the line, which are stopping the clinicians, the pharmacists, the patients, or all the communities to use the drug in a rational way? First, the prescriber. The prescriber may obtain some financial benefits in prescribing more drugs because every pharma company has they have appointed MRs, medical representatives, and they are coming and meeting the physicians and showing the many benefits. And one type of benefit is the financial benefit. So due to that, the prescriber may tend to attract for the large sale of the drugs to have some benefits and repeatedly prescribe the drug. The chemist may also promote the irrational use of drugs to enhance his or her sales. Similarly, easy availability of even Schedule H drugs, like which are easily available. Anyone can take the drug and can use by his or her own, because in India, most of the patients are or the individuals are not thinking that they should approach the qualified doctor. First, they will not go to any doctor. Second, if they will go, they will go to the quacks only. And uh, third, they will stop the drug. So, no proper training and continuous education to the prescriber. Yes, very important part. Nowadays, ICMR has started a very good program training to the prescribers under the name and style of prescription skill program, where they registered every time they got basically having a number of registered 50 to 80 individual, and there is a training of 3 months training program where they are being educated regarding the prescriptions, how to prescribe the drugs, and what type of prescription is coming under what type of schedule, and what are your duties, and which type of drug cannot be prescribed without the uh, proper permission of the uh, body. So, which are the approving bodies in the hospital? For example, the fourth generation's cephalosporins cannot be prescribed by any prescriber. He or she will have to take permission from the approving body in the hospital, which are generally in the line with the guidelines issued by the Government of India or ICMR. So there should be a proper training for everyone. So there is a wrong notion among common men that every ill has a pill, resulting in medication even in ailments which are self-limiting. So there are many types of diseases or ailments which are self-limiting. They are not require anything to under the name of treatment, but here also we are using some types of pills. Again, irrational use. Consequences, we can see the consequences. Nobody knows, neither the doctor or nor the patient knows how and why it happens. Unpleasant and terrible experiences or different types of ailments or new types of symptoms due to the irrational use of drugs. Now, certain measures to promote the rational use of drugs. First one is educational measures, second is regulatory measures, third is managerial measures. Now, the drugs uh, with use indicators. Prescribing, going back to the first slide, again, as we have discussed the educational measure, we should educate the communities or the healthcare workers who are in the drug uh, trade or healthcare setup. Regulatory measure, there should be a proper regulatory supervision at every level in the nursing home, in the hospital, in the corporate systems, and all about sorry so that the irrational type of prescription can be discouraged. Then managerial level, starting from the manufacturing of the drugs to the end of the chain, to the end of the chain or till the supply, they should supply all these drugs under the proper guidelines or should be strict protocols. Now, the drug use indicators. There are certain indicators where uh, one can assess how and when and where the drug is required. Now, the prescribing indicators includes average number of drugs per prescription. It is very important. You should know if you are going to prescribe. You should know how many drugs at what time can be given, and this is your domain to assess the history and to assess the proper symptoms. And those symptoms can be basically considered at last, which are normal one or not so severe. So next is percentage of drugs prescribed by the generic names. Yes, uh, it is mandatory nowadays that everyone should prescribe according to the generic name of the drug. The percentage of time and antibiotic is prescribed. Yes, it is very mandatory that if the antibiotic course is prescribed to anyone, it is the duty of the physician also to follow to proper follow up, and it is the duty of the patient also to go according to the instructions properly, because anything in case of antibiotic therapy, if the doses are not taken by the patient, it is a very serious problem, or it may lead to a serious problem for the environment or for other human beings also. And the person will also suffer because the healing or will delay, or the improvement will also delay. So proper use of antibiotic therapy should be there. If 6 doses are mandatory, then he or she have to take 6 doses, only 6 doses, not more than that, not less than that. There are many consequences. We will discuss later on how the improper use of antibiotic drug led to the serious type of complications in the world. So patient care indicators, again, average consultation time, average dispensing time, percentage of drugs actually dispensed, then percentage of drugs adequately labeled, and patient knowledge of correct doses. It is very important. You should ask the patient that he or she, if he or she is having a proper knowledge of this doses form and at time of dose or the dose intervals. Then facility indicators, availability of copy of essential drug list or formulary in the clinic or in the hospital setup, so that one may able to select the drugs from the essential drug lists only. Then availability of key drugs. It is very important. Simple or the key drugs should be there at every level. Now, the guidelines. Most important step in drug therapy is correct diagnosis. The second step is to assess whether the need of drug is genuine or not. Sometimes the medicines are prescribed on the basis of the patient's basically desire, not the need. So this is wrong. If therapy is essential, when then the various treatment should be considered. So next step is the selection of dose which is appropriate for the patient. Patient, for example, the last point here, I would like to explore one thing. If the patient is uh, having or geriatric patient or the old age patient, if he or she is not able to take the pills frequently, so then you can prescribe a sustained release type of preparation further. So the dosage frequency may be reduced or the patient complied will be improved. Patient should be clearly instructed regarding his ailment, how to consume and when to consume the drugs. Degree of effectiveness of the therapy should be monitored as well. If there is no effect by the therapy, then it must be diagnosis and other associated things of should accept should be reconsidered. Rational use of drugs again includes rational prescribing, rational dispensing, then problems of rational drug use, learning about drug use problems, sampling to study the drug use, indicators of drug use. All these things are contributing towards the learning of the rational use of the drugs. It is also named as RUM. So, as we have discussed, appropriate indication, appropriate medicine, appropriate doses are the key parameters for the correct dispensing and appropriate information of the patient. And the last is adherence to the advice or the directions given to him by the physician. It is very important on the part of the patient. So this is the cycle which is showing in general, basically, as it starts from here, from the diagnosis, follow-up, or prescription of the medicine, then it is followed by the dispensing and adherence to the protocol, then again follow-up. If this cycle will go as it is in a proper way according to the guidelines, there will not be any incidence of irrational use of drugs, but this cycle is disturbed. So examples of irrational use of medicine now: polypharmacy, mean uses of different classes of drugs at a time unnecessarily. So average number of medicines per prescription. Then unnecessarily use of medicine where no medicines are required. For example, antibiotic misuse or irrational use of antibiotics in case of many conditions, common colds and all, and misuse in case of respiratory tract infections. Then wrong medicine. Less than 40% patients are treated according to the STGs. Ineffective medicines or with the medicine with doubtful efficacy. And without any reason, most of the time multivitamins and tonics are prescribed by the prescribers, which have no meaning. For example, in case of low vision, we can see most of the time vitamin A is prescribed. It will not improve the vision, though it will affect, exert some other effects in the body, but it is a myth that vitamin A will increase the vision. No, nothing like that. Then unsafe medicines, anabolic steroids for athletes and as appetizers for children. Again, a very dangerous sign. Then underuse of available effective medicines. then incorrect use of medication, incomplete antibiotic therapy, as we have discussed right now. Then the factors responsible for irrational use of medicines or drugs. So, at the level of international platform, drug promotion and marketing level. So basically, it is misleading, biased, scientifically inaccurate, and encourage. They are encouraging the overuse and of many medicines which are of high cost, and many of the patients are using without any reason. They are marketing in such a way. Uh, Next is market dynamics. They invest more in developed countries basically to increase their turnovers. So at national level, there are weak laws and regulations, and which can monitor, which can stop the production of medicine with poor quality, then poor HRMs or economic status or other data which is not so frequently available at national levels. Other factors at health system levels, unreliable suppliers are there which are promoting unreliable supplies of the medicines or other medical devices. Then poor planning of the drug needs, poor infrastructure of storage, poor information management systems, lack of monitoring and supervision. At the level of prescription or the level of a physician, prescriber, lack of information and training regarding the prescription or regarding the new drug delivery systems or the new drugs. So that's why it has been started uh, uh, approximately 10 to 15 years ago. It was made mandatory for every physician to attend some workshops or medical updates conferences in the year to get some credit points. And those credit points were basically made mandatory for the renewal of their license for practice of medicine. So these are types of things are in pipeline or in the system, but not on a strict level so far. So, if we will be able to educate the prescriber one day, then 50% of the irrational use of drug practice will be down. So, lack of information and training, outdated prescribing practices, heavy patient load, pressure from pharma industries. Yes, this is a conflict of interest. Then at the level of dispensing, lack of qualification and training and heavy patient load, they may give a wrong medicine. Patient at the level of patient and at the level of community. Because this is the irrational use of drug is not only happen due to other factors. In this case, the patients are equally responsible for the uh, development of irrational use of the drugs because they do not follow the instructions or the directions given by the physician. So non-adherence of the to the directions, then cultural beliefs. Most of the time, they are having cultural beliefs that they should not go to the doctor on Thursday or Tuesday, or they will not go for operating the condition. They will not get operated during this month. All these things. Then affordability, education, and availability. These are the things. If the drug is not in their reach, they will not purchase that drug, and education is not there properly for the layman, or if the drug is not available, the pharmacist will give them a substitute of that drug. That is also under this phenomenon. Then adverse effect of international this irrational use of medicine. Impact of quality of medicine is there. Then impact on therapy and medical care. Impact on antimicrobial resistance. Impact on cost and psychosocial type of impact are there. Out of these, what we have seen so far, this impact, the impact on antimicrobial resistance is the major one. I'll show you the slide in the last, that what type of effect is going to happen in the coming few years. This is the vicious cycle of prescription leading to the irrational use of medicines. If we will see, the patient is saying, I take so many medicines because my doctor prescribes them. And on the other hand, the doctor is saying, I prescribe so many medicines because my patients expect them. Because here, the patient doctor is being justifying him or herself that the patient is required more than one type of drugs. That's why I am prescribing. But here, the patient is saying that the doctor is giving to me, that's why I am taking. Nobody is asking to each other. But this practice should not be like that. So there are certain approaches to achieve rational uses of the drug. Patient problem. Understand the causes of the problem of the patient. Detailed history of the illness, medication history of the patient. Diagnosis, past medical history, including medication history, present complaints, and if patient is not diagnosed accurately, then the therapy is termed as irrational therapy or the treatment. Therapeutic objectives should be laid down in such a way that they should be the prescription should be able to relieve the symptom immediately or prevent the disease properly in an efficacious way, or the combination of both. The treatment option should be in a proper domain, that the treatment option, drug of choice, or changes in lifestyle modifications or lifestyle modification should be prescribed. But it should be in a manner that the physician should be able to convince or to counsel the patient properly that you are not required any drug at this time. You just go for lifestyle modification and you will be okay. And it is the duty of the physician to counsel him that you are not required any type of drug. But if the drug is required, then it is the duty of the physician to select the drug of choice at that time. Not there is no time for experimentation. That first we will prescribe this drug, and second this drug, or the third follow up on this drug. No, only the drug of choice. If drug is required, then selection is based. It should be based on the efficacy of the drug, safety of the drug, sustainability of the drug, the suitability of the drug. Then it should be cost effective in nature, ease of administration. As I already told you, if you are going to give a drug which at the dose frequency is 3 to 4 times, there are chances of missing of dose. So select the dose in a proper way so that the frequency should be reduced. Then storage requirement. Start of the treatment should be in a manner that drug should be prescribed and start the drug administration in a proper way. Educate the patient about the beneficial and side effects of the drugs, benefits and the side effect of the drugs. That how the patient should deal with the side effects if there will be any kind of side effect. It doesn't mean the patient may have any kind of side effect, or he or she is authorized to leave the drug. No. Next visits should be planned for patient to assess the treatment in a proper way. Then result of the treatment. Result is obtained from physical examination and from the lab investigation. If the patient responds to the therapy, it is termed as rational therapy. And if vice versa, then assess the problem from step number 1. Conclusion of therapy, verify from the results, therapeutic goals are achieved or not, patient problems are solved or not. If these questions are not answered, then verify whether the patient showed compliance or not. Do all the diagnostic again. So, rational use of drug can be achieved by drug use process, that is known as abbreviated as DUP indicators. So here are DUP indicators. So this is the DUP indicator stage, need of a drug action. Ensure there is an appropriate indication for each drug and that all medical problems are addressed therapeutically. Select the proper drug. Select and recommend the most appropriate drug based upon the ability to reach therapeutic goals with consideration of patient variables. Very important. Then the formulary status and cost of the therapy. Then selecting the drug regime. Select the most appropriate drug regime for accomplishing the desired therapeutic goals at the least cost without diminishing the effectiveness of the or causing toxicity. Very important. If you are cutting the cost, the drug should not cause or pose any toxic threat to the patient, as well as it should be equally effective as the other costlier drugs. Very important. Then providing the drug, facilitate the dispensing and supply process to the drugs are accurately prepared, dispensed in ready to administer form and delivered to the patient on a timely basis. Drug administration. Ensure that appropriate devices and techniques are used for drug administration. Then monitoring of the drug therapy. Monitor the drug therapy for effectiveness or adverse effects in order to determine whether to maintain, modify, or to discontinue that particular drug or therapy or drug regime. Then counseling of the patient, again very important. Counsel and educate the patient or caregiver or attendant of the patient about the patient's therapy to ensure proper use of medicines. Evaluate the effectiveness. Evaluate the effectiveness of the patient's drug therapy by reviewing all the previous steps of the drug use process and taking appropriate steps to ensure that the therapeutic goals are achieved. 4 interventions to promote the more rational use of medicines. A mandated multidisciplinary national body should be there to coordinate the policies related to the use of the drugs. Then there should be mandatory clinical guidelines for everyone, for physician, for specialists, for super specialists also. Then essential medicine list should be there, which should be based on the treatment of choice at every level of health care system, from dispensary to clinic to hospital to tertiary care hospital to corporate hospital, like that. Drugs and therapeutics committees and in districts and hospitals should be in place, like antibiotic, rational use of antibiotic committee, then other types of committees, many committees which are generally advised at the level of district, state, or center and hospital level. They should be in place and they should be not on the papers only. They should work according to the proper protocol. Then problem-based pharmacotherapy training in undergraduate curriculum, which is generally now has been introduced by the NMC. Now the continuing in-service medical education as a license requirement. As I already told you, prescribing scale program as well as the mandatory attendance in the medical update is required for the passed out graduates. But this is not enough. Then the supervision of an audit and the feedback. Feedback is very important. Then independent information on the medicine should be there. Then public education about the medicines. Then advances of the towards financial incentives, appropriate and enforced regulation, and sufficient government expenditure to ensure availability of the medicines and the staff. So there is no universally agreed definition of good prescribing. The WHO promotes the rational use of medicines, which require the patient receives medication appropriate to their clinical needs in doses that meet their own individual requirement for an adequate period of time and at the lowest cost to them and their community. This is the reputation. Why? Now the picture has been cleared. We have started from this definition. The prescriber should have the following four aims. Prescriber, only four aims: maximize effectiveness, minimize risks, minimize cost, and respect the patient choices. Basic professional behavior is expected in the practice. This is the chart which is showing the professional behavior and ethical principle. Do the very best you can for every patient, beneficence in the form of beneficence, or in all cases, do no harm. This type of data can be collected without writing their name and sign. So another popular framework to support the rational prescribing decision is known as STEPS: safety, tolerability, effectiveness, price, and simplicity. This is the this should be the goal of every prescriber. He should follow the steps. He should prescribe the drugs which should be a safer one. It should be tolerable for the recipients, individuals, or the patient. It should be very effective. Price should be low, and it will be a simple one without the adverse effects. A framework for this good prescription. So this is showing these are the principles. First, identify the problem, and then followed by the history taking, examination, and investigations. Then identify the current medicines and their effects if the patient is already on the medicine. Then come the balance and potential benefits and harms. So agree an appropriate cost-effective regime, right and accurate prescription here. So monitor the benefits and the harms. Got it? Then another way, identify the problem, work in partnership with the patient to solve the problem. Now, what is your problem, and what type of medicine you can take? You can go to this side also, and you can take decision. Provide the information, and the patient, the carers or attendants, and the others. So this is the condition. So very important in all the cases is to avoid the medication errors here. Criteria for rational prescribing. Again, appropriate diagnosis, all the things are here listed again. Yes, requirement knowledge for rational dispensing. Stability and dispensed medicine and their ingredients. Then knowledge regarding the principles of compounding, dosage form and dosage schedule. Why this information should be required, because if the solid ingredients are there which are not compatible with each other in liquid state, so one may not mix them in a liquid vehicle or state. Got it? And dosage forms and dosage schedule, physical, chemical, and therapeutic incompatibilities, packaging material, and methods. Some drugs are not packed in the polythene type of containers or in plastic containers, and some drugs are being protected from light. The special type of containers are there, amber colored bottles are there, and labeling procedure should be proper, because labeling is a mandatory law. Without any labeling, it is a without any labeling to produce or to dispense the drug, it is a criminal offense basically. So labeling procedure should be properly known to all the dispensers. Then all the legal requirements, whether the drug is coming to which type of schedule, or in case of labeling, if it is under coming under the toxins, then it should be labeled or superscribed as toxin. If the dilution is required, then it should be superscribed with dilute the, for example, anything which should be diluted with equal amount of water, dilute the solution with equal amount of water, keep away from the reach of children, for external use only, shaking and mixing is required, shake and shake well before use, etc. So these are the things which should be necessary to follow on the part of the dispenser. Who is the prescriber, or whose behavior do we change? Physician, paramedics, pharmacist, injectionist, patients, clinical officers, clinical attendants, dispensers, drug sellers, relatives, and friends. Now, the relatives and friends mean relatives of the patients or the friends. All are in this category or dealing with the prescription. So, all these categories of the individuals or the workers or the officers have to be proper knowledge of the rational use of drugs. Then intervention strategies to improve the medicines, training of prescribers, formal education, in-service education under the name of CME. Then printed material, which is very important, material by the recognized authorities or the bodies should be circulated time to time among the physicians. Then clinical literature, again very important. Then treatment guidelines and formularies. Then patient education, influence, and opinion. Then managerial strategies, monitoring, supervising, and feedbacks. Health service teams should be involved in that. Government inspectors, assessment for. Then limited procurement list, drug use review, regional drug committees, then structured medicine order form, which is very important. Then diagnostic and treatment guidelines, again very important. Then course of therapy and packaging. And certain economic strategies should taken into consideration: price setting, capitation based budgeting. So the reimbursement and user fees, then including their insurance and various schemes issued by or started by the government. Then regulatory strategies, medicine registration, limited medicine lists, prescribing restrictions, and dispensing restrictions. This is the picture I would like to show you. This picture is showing the global incidence of annual deaths due to deadly diseases, along with the projection of increase in the death rate due to AMR in 2050. This is the source is Livato et al. 2019. It was published in 2019. AMR, antibiotic microbial resistance. Here we can see this is the scenario, global scenario, which is showing that uh, this, that 60,000 are dying due to tetanus, or 1.2 million due to traffic incidents. Then per year data is there. Then due to 1.4 million, due to diabetes 1.5 million, due to cholera 1,10,000, and due to cancer, which is the most emerging disease nowadays, it has been recorded that 8.2 million in 2050. But in 2050, you can see the antimicrobial resistance cases or the death due to antimicrobial or antibiotic uh, resistance. In 2050, the number will be 10 million. It will cross the 8.2 million deaths which are occurring due to cancer. Now you can see, now you can guess how serious this problem is. So we should use all the drugs, including all the antibiotics very judiciously. Judiciously mean wherever they are indicated. Otherwise, unjudicious use or irrational use of antibiotics led to the development of resistance in the microbes. Most of the people nowadays dying due to the non-availability of the proper antimicrobial drug because of the incidence of the resistance in the world. So we should be very careful while using antibiotics. The core policies should be in place. A mandated multidisciplinary rational a national body which should coordinate with the medicine and the use of policies related to the use of medicines. Then clinical guidelines, essential medicines list based on the treatment of choice, drugs and therapeutic committees in districts and hospitals. Then problem-based pharmacotherapy training in undergraduate curriculum. Then continuing in service medical education. We have repeated. Current problems at the level of hospitals and nursing homes, we are facing many types of problems at the level of prescribers, or these problems are also at the level of patients. At the level of hospitals, lack of enforced regulations and coordination based on science-led, evidence-based standards. At the level of prescribers, poor knowledge and skills in the practice of science-based medicines of Ayurveda and other type of system of treatments also. Similarly, here at the level of patient, we can see unable to differentiate traditional and modern medicines, especially from modern medicine from Ayurveda. So lack of monitoring and evaluating process in the status patient, no CM is on science-based medicines, and the current CM is focused on the medicine-based science, which is not intended in other types of system of treatments like Ayurveda, and misled beliefs on the systems of the medicines, modern medicines, and unqualified people like in the field of dispensing or dispensing staff, and sometimes quacks are treating the patients. Then at the level of prescriber, empirical polytherapy, uncertainty based diagnosis and treatment in making. So in case of patient, cultural practices are misinterpreted, and they are preferring the natural one, only Ayurveda system of treatment, or some they will go for medicine, modern medicine. So these should be clarified to the patient basically. Then the poor hygiene, unavailability of the scientific diet to the patient owing to the ignorance of the physicians. Then self-medication, telemedicine and its potent hazards. So this is the schematic representations of changing of drug use problem. The first is examination. As I have already told, again I am giving emphasis on this process that examination should be in a proper way. So mirroring the existing practices, descriptive in nature and quantitative on the basis of quantitative study. Then diagnosis should be a very scientific or on the basis of clinical studies, should identify the specific problem and cause. So in-depth qualitative and quantitative studies. Then treatment. While treating the patient, the prescription is an integral part and it should be uh, its design and implementation intervention should be unique on the basis of the data collected and the outcome measured so far. Then to counsel the patient regarding the prescription and to convince him for the proper follow-up. Then follow-up, in the follow-up, what are the factors, what are the things we recorded? It should be the basis of measure changes in the outcome. What type of ailments were here when it was prescribed, and during the follow-up, what type of systems are relieved. These should be noted in a proper place. So it should be again quantitative and qualitative evaluation. Again, these are two basically based first examination and a follow-up. Again, they are meeting over here, or we can say again this cycle will go as it is. Here, if the improper diagnosis is there, it may lead to the improper treatment or improper interventions. So if we will go like this vicious cycle will go on and patient will not get any kind of benefit. So there will be a no clinical efficacy or therapeutic efficacy or clinical significance. So to improve the clinical significance and therapeutic efficacy, it is the need of the hour to use the drug in a judicious or a rational way. Now the role of pharmacist in this case. So legally pharmacist is not authorized to prescribe but can play a major role in promoting the rational use of drugs. As the pharmacist involves in the selection and procurement of drugs, so the selected drugs should be in accordance with the essential drug concept and cost effectiveness because these things can be monitored by the pharmacist. Pharmacists should indulge in good inventory control, which help in regular monitoring of the stocks. Now, the question for all of us, are we ready to jump in? Thank you very much. Thank you.
Thank you, sir. Thank you so much, sir.
Hanji, thank you.
Yes, it was a very informative session, sir. And sir, you have focuses on the what are the current problems during the prescribing of the medicines, and what we should, what are the remedies for that. Okay, so and if the participants are having any questions, they can write on the chat box.
Okay.
If anyone is having the questions, they can write on the chat box. Okay. Okay, thank you, sir. As a token of appreciation, sir, I will felicitate you with the e-certificate on behalf of Parul University. Please accept it, sir.
I am not able to see it. Okay.
Okay,
Where?
sir. I'm sharing. I'm
Okay,
sharing.
okay.
One minute. Sir, can you see the certificate? Hello.
Screen is not properly open. Kindly, can you enlarge it a little bit?
Hello. Pallavi madam, have you joined through mobile? Actually, sir, Singh sir. Madam has joined through mobile, so she has shared her mobile screen.
Okay, ma'am. Okay, okay.
Yes, sir. Yes, we will send email of e-certificate and Thanksgiving letter, sir.
Thank you, ma'am.
Thank you very much, sir. Thank you very much. You have covered all the aspects very nicely. It was very nice session.
Okay, ma'am. Thank you, ji.
We are very thankful that
Actually,
your time.
I have basically only 1 hour was there, out of which we have spent 10 minutes in settings. I have skipped many slides also, but whatever is relevant and what was the most important, I have discussed all these things.
Yes.
And I hope we will continue in future also these type of things and hot topics and the topics of which are the need of the hour. And there are many things which are where the role of pharmacist is very important, ma'am, in future. And many things are there. It is not in the form of basically regulations or in the form of curriculum, but uh, most of the scientists have identified the role of pharmacists also. Because if we will start from now onward to train them, we will brought about a big change. So after waiting for next 20 to 30 years, it will be difficult. So we should give the proper knowledge and training to the budding pharmacists also, because they are going to play a major role in industry, in dispensing, and clinical setup, in the hospital pharmacies also.
Yes, sir. Hello, Pallavi madam. Sir, I think Pallavi madam is facing some network issue.
Okay,
So,
ma'am.
yes, sir. Thank you once again for your valuable time, sir.
Thank you, ma'am.
And suppose you are coming to Baroda, please do visit Parul University.
Thank you, ma'am. Thank you.
Welcome, sir.
Zero.
Yes,
Zero.
sir. And we can have your offline expert talk with our students.
Okay, ma'am. I would like to share your biodata in my BOS also.
Yes, sir.
I have also served as a controller of examination for 7.5 years.
Okay, sir.
Now I am in the faculty of pharmaceutical sciences also, faculty of medical sciences, then board of studies in pharmaceutical sciences also,
Yes.
then member of board of studies in Center for Biomedical Research. That is the center where our medical and allied research is going on.
Yes, sir.
45 PhD students are there. Yes, sir.
Okay. Very nice.
Pharmaceutical sciences, from medical sciences, from dental sciences, from nursing sciences. There is a separate body, which is or institute in our university. So under the name of Center for Interdisciplinary and Biomedical Research.
Yes, sir.
So there, this is conducting a PhD course according to the proper UGC mandate, and coursework is there. Then conducting the PhD programs all over the university.
Yes.
Thank you, ma'am. Thank you.
Okay, thank you. Sir, Pallavi madam, can we conclude the webinar? Okay, so I think she is
Madam
taking
is having some network connectivity issue.
Okay, ma'am. One thing I would like to ask.
Yes, sir.
During my presentation, is there any technical hitch regarding the voice or not?
No, sir.
Was it clear?
Yes, sir. And recorded version will be available in Facebook also, PU webinar page.
Okay, ma'am.
Yes, sir.
One thing more. Actually, ma'am, I have asked when I have been assigned this uh, webinar. I have asked clearly that who are the target audience.
Yes.
Since the students were there, I have taken it in that a way so that they may be able to understand the things in a simplified way. Basically.
Yes, sir.
In future, if it will be for particular faculty or other stream, we would like to have different types of level. for
Okay.
them.
Sure, sir. Yes, sir. Okay. Over to you, Pallavi madam. Okay, so on the behalf of Parul University, let me conclude this webinar. Yes, Pallavi madam. Yes, on the behalf of Faculty of Pharmacy, Parul University, I would like to thank all of you, all the participants and all the faculty members for joining this webinar. See you in our next webinar. Thank you all. We hereby conclude our webinar. Thank you.
Hello?
हाँ जी